I want to take a look here at this intravital microscopy video. This is the local microcirculation of a male who's been under chronic stress. And what we're seeing here is a zoomed in view of a local area of microcirculatory vessels. And on the left side of the screen, you're looking at an arteriole that's vertically orientated, and on the right, also oriented vertically, is a venule. The small vessel that is branched off horizontally on the left is a capillary. Arterioles are responsible for bringing oxygen-rich blood into the capillaries, which then deliver the blood and its components to the cells, which are vital for these cells to function. You can see the blood flowing clearly in all the vessels here observed, but the little capillary is not being adequately perfused with blood. Therefore, the cells do not get what they need to work properly. You're going to see here also that there's no vascular movements or oscillations occurring with the arteriole on the left side, which should be. In addition, there's restricted blood flow, there's poor perfusion, and diminished venous return. Too much of this going on, and you're going to feel tired, you're going to feel sluggish, maybe even experiencing cold hands, cold feet. But one thing's for sure, poor blood flow can be the precursor to many issues that people experience every day, and they don't even know it. Let's take a look here at what happens to BEMER after it was only turned on for 3 minutes of treatment. You'll already start to see this increase in blood flow. You can see the capillary open up. There's an increased arterial flow. And what you can also see is this increased venular flow, returning carbon dioxide back to the lungs and clearing out the waste products from our body. Here we are after 6 minutes of BEMER use. I want you to pay special attention to the right side, to this venule, where the white blood cells are rolling over the endothelial walls of the vascular lumen. Think of it. It's like the cops or the police being out on the streets patrolling and protecting you. That's your mobile immune system. When your blood is flowing, when it's moving, your immune system is more vital. If your blood is not functionally flowing, you can't possibly have a high-functioning immune system. Therefore, you're not protected. You can think about it this way. If you're perfused, you're protected. So 30 minutes after starting therapy, the effects of BEMER therapy, while temporary, have been documented to last up to 18 hours for some users. Sometimes more, sometimes less. But the fact is, BEMER is an incredible tool to support your local circulation and keep you performing at your best.
Here's an independent study that was done on the PEMF and vasomotion and oxygen utilization. As you can see, the device we used, the BEMER, outperformed the competitors by 600%. What they did is they put patients on different devices for 3 days and then took them off. You can see on the 4th day, all the competitors' vasomotion and oxygen utilization dropped to almost zero, while the BEMER had lasting effects. In fact, it only dropped to above the highest point of the next competitor.
With Mr. Slick Willie Shaw, Will Trotters up there.